Good morning. I'm Rema Stanley, tutor at Ripplem College of Nursing, Department of Mental Health. In this video, I'll be discussing with you about the nurse's task in the phases of therapeutic nurse-patient relationship. Now, let us see what is therapeutic nurse-patient relationship. A relationship is defined as a state of being related between two individuals. So the nurse and the patient interacts with each other in a healthcare system with the goal of assisting the patient to use personal resources to meet his or her unique needs. So in therapeutic relationship, the nurse and the patient work together towards the goal of assisting the patient to regain the inner resources to meet life challenges and to facilitate growth. Now let us see the phases of therapeutic relationship. There are mainly four phases. These are pre-interaction phase, introductory or orientation phase, working phase, and termination phase. What is pre-interaction phase? This phase begins when the nurse is assigned to initiate a therapeutic relationship and includes all that the nurse thinks, feels, and does immediately prior to the first interaction with the patient. Now let us see the nurse's task in pre-interaction phase. This includes to explore own feelings, fantasies, and fears, to analyze own professional strengths and limitations, to gather data about patient whenever possible, and to plan for the first meeting with the patient. Some of the problems encountered during this phase are difficulty in self-analysis and self-acceptance. The nurse must accept herself and behave in a way which is congruent with her own personality. At a time, the nurse may also experience anxiety of varying intensity during a pre-interaction phase due to the role threat, feeling of incompetence, fear of being hurt, fear of losing control, and fear of rejection. And sometimes the nurse may also experience boredom, anger, indifference, and depression. Here are some of the ways to overcome the problem. That is self-analysis. The nurse should also explore feelings of inferiority, insecurity, and behaviors. As self-analysis will help the nurse to accept herself, and also to be effective, the nurse should have a reasonably stable self-concept and adequate amount of self-esteem. Next is to identify the goals in advance. It is also helpful to conceptualize in advance what she wishes to accomplish during the relationship. She may also get the guidance of a senior staff and supervisors. Next is introductory phase or orientation phase. It is during this phase that the nurse and the patient meet for the first time. One of the nurse's primary concern is to find out why the patient sought help. This forms the basis for the nursing assessment and helps the nurse to focus on the patient's problem and to determine the patient's level of motivation. Now let us see the nurse's task in the orientation phase. This includes to establish rapport, trust, and acceptance, and to establish communication and also assist in the verbal expression of thoughts and feelings of the patient. To gather data, including the patient's feelings, strengths, and weakness. Also to define the patient's problem, set priorities for the nursing intervention, and mutually set goals. Some of the problems encountered during this phase are the manner in which the nurse and the patient perceive each other. And most often, the nurse's stereotype view of a psychiatric patient. The other problem includes problem related to establishing an agreement, that is, a mutual understanding and agreement to work together. Here are some of the ways to overcome the problem. First and foremost, detecting the nurse's perception. The nurse must be willing to relate honestly to her perception, thoughts, and feelings, and to share this information which is collected during the nurse patient interaction with her supervisors. Working phase. Most of the therapeutic work is carried out during the working phase, where the nurse and the patient will explore relevant stressors and promote the development of insight in the patient. The nurse's tasks in the working phases are to gather further data and explore relevant stressors, to promote patients' development of insight and use of constructive coping mechanism, to facilitate behavior change and encourage him to evaluate the results of his behavior, and provide the patient with opportunities for independent functioning, and also evaluate the problems and goals and redefine as necessary. Some of the problems encountered during this phase are testing of the nurse by the patient. The patient may test the nurse in a number of ways for a number of reasons. For example, he may wish to check her ability to set limits and abide by them. Progress of the patient. Another barrier is the nurse's unrealistic assumption as to the progress the patient should be making. A nurse who was enthusiastic about the patient's improvement may then become discouraged when he does not progress at a steady state. The nurse's fear of closeness. If the nurse fears closeness too much, she may react by being indifferent, rejecting, or by being cold towards the patient. Life stress of the nurse. A nurse who has difficulty in coping with her own life problems cannot help a patient in making appropriate behavioral changes. Resistant behavior may be shown by the patient in following ways: suppression and repression of relevant information, intensification of symptoms, breaking appointments or coming late to his session, acting out or irrational behaviors, reporting physical symptoms which may occur only during the time the patient is with the nurse, hostility, dependence, and sometimes sexual interest in the nurse. During this phase, transference and counter-transferent reaction may also be seen. It is the form of resistant behavior, where transference mean is the unconscious transfer of the feelings and attitudes of the patient towards the nurse, which originally associated with another individual in the patient's life. Countertransference is the reverse of transference, where the nurse would display unresolved problems from an earlier relationship to the patient. Ways to overcome is to get the guidance of a senior staff or a supervisors. Secondly, handling resistance. The first thing the nurse must do in handling resistance is to listen. When she recognizes the resistant, the nurse must use clarification and reflection of feelings, as clarification will help to give the nurse a more focused idea of what is happening. Next is termination phase. This is the most difficult but most important phase of the therapeutic nurse-patient relationship. And the goal of this phase is to bring a therapeutic end to the relationship. Here are some of the criteria for determining the patient's readiness for termination. This includes patient's experiences relief from presenting problems. Patient's social functioning has improved and isolation has decreased. Patient uses more effective and productive defense mechanism, and also patient has achieved the planned treatment goals. The nurse's task in termination phase is to establish reality of separation and to mutually explore feelings of rejection, loss, sadness, anger, and related behaviors. The nurse must also review the progress of therapy and attainment of goals. Formulate plans for meeting future therapy needs. Some of the problems encountered during this phase are angry behavior, which may be demonstrated by the patient and sometimes may attempt to punish the nurse. The other time, the patient may exhibit depression in reaction to threatened loss. Fault finding is also another behavior which the patient may state that the therapy is not beneficial or not working and therefore refuses to accept the treatment. Flight to hell. This is also exhibited by a patient who suddenly declares that there is no need for therapy and claims to be all right and wants to discontinue the therapeutic relationship. So, this is a form of denial or a fear of anticipation over separation. Flight to illness. It occurs when a patient exhibits sudden return of symptoms. This is an unconscious effort to show that the termination is inappropriate and that the nurse is still needed. Some of the ways to overcome are to be aware of the patient's feeling. The nurse should be aware of the patient's feeling and be able to deal with them appropriately. The nurse can also assist the patient by openly eliciting his thoughts and feelings about termination. Assist the patient in incorporating positive aspects of the relationship into one's life. And this is one of the goals of termination in the therapeutic nurse-patient relationship. And last, it is important to take the support of a senior staff and supervisors. So in this video, we saw the nurse's task in various phases of therapeutic nurse-patient relationship. Thank you.